Hi Josh, can you tell us a little about your background, your certification in anti-aging, and why you have chosen to focus on testosterone therapy?
Sure. I graduated from Long Island University in New York in 2006. And after being introduced to hormone replacement therapy, I found it just really truly amazing the things that it can do for both men and women. That prompted me to go on to complete a certification by the American Board of Anti-Aging Health Practitioners and the American Academy of Anti-Aging Medicine, specializing in men's wellness, hormone replacement therapy, and rejuvenating medicine.
There's been quite a bit of press on andropause or menopause. What do these terms mean and who is likely affected?
Sure. Andropause and menopause are kind of terms that have been made a little bit more popular, with the media. But simply put, those terms refer to the decline in men's hormone and testosterone levels, and then the associated symptoms such as fatigue, weakness, depression, sexual problems, just to name a few.
What are the benefits of testosterone therapy?
There are a lot of benefits that can be associated with testosterone therapy, both physical and psychological. Improved energy levels, improved motivation and drive. We see increases in strength and lean muscle mass. And in turn, that can also help increase one's metabolism. So, improved weight loss or getting rid of the unwanted weight. It can help to decrease stress and the depressive moods. Of course, we see improvements in sexual desire and function. And, also just an overall sense of well-being.
Who are the likely candidates for testosterone therapy?
Candidates can really be pretty much any guy out there that is, suffering from or feeling the effects of low testosterone, kind of like we mentioned before, decreases in energy, fatigue, decreased libido, problems with sexual function, weakness, irritability, those sorts of things. We know that studies show that men's levels of testosterone start to decline after age 30. So that's a lot of times when guys might start feeling some of these effects, or when they should start looking for some of these symptoms associated with low testosterone. In addition to that, there are certain conditions that can also be associated with low testosterone. Such as diabetes, it can be a common one. History of certain traumas. It's been reported in some studies that history of head trauma, also any kind of history of groin trauma, that sort of thing can result in lower testosterone levels. Also things such as depression and post-traumatic stress syndrome have also been associated with lower testosterone levels as well.
How does one go about qualifying for therapy, or can anyone qualify?
Yeah, not anybody can qualify. Typically guys out there that think they may be having some of the symptoms of low testosterone or wondering if they might be candidates for testosterone therapy would, simply make an appointment to meet with a provider. They'd sit down for an office visit, a consultation, and for lab work. And then, kind of depending on the results of that, it would then be decided whether or not they're good candidates for testosterone replacement therapy.
How are patients monitored?
Typically, once patients start on therapy, there should be pretty frequent routine monitoring. Usually in the first 6 months of starting therapy, lab work is repeated every 2 months for the first 6 months in order to make sure that the clients are seeing the results that they want to see, and also, of course, making sure that things are going well from a medical standpoint, and that also helps us to minimize any potential side effects and risks. So it's really beneficial from a safety standpoint as well.
Is there physician and medical oversight?
Yes, absolutely. It's really no different from any other clinical practice. There should be a physician or a qualified medical director that oversees every program.
Are there any risks associated with testosterone therapy?
Yeah, again, just like virtually any other medical therapy or treatment, there can be risks associated. However, thankfully, with otherwise healthy men, usually most guys don't experience any real significant side effects. But again, this is something that can vary significantly from person to person, and risk factors and that sort of thing should always be discussed specifically with the medical provider. Thankfully, things like the side effects and some of the risks can usually be pretty easily managed with simple dose adjustments or supplementation, that sort of thing. And also they can usually be prevented with the routine monitoring as well.
In conclusion, why should someone start testosterone therapy? Is it easy to do?
Testosterone therapy can really help the guys out there that are suffering from the symptoms of low testosterone or andropause. If there's any guys out there that think that they may have some of the symptoms associated with low testosterone or andropause, I would encourage them to make an appointment with a provider and get their levels checked. And it is really a pretty quick and easy process.